I'll assume it's doing it. Go with that. All right. It's kind of culling through this. So the primary sex organ in males are the testes. That's plural. Testis is singular. So in this picture you can just see one. Because they are the primary sex organs, they're also called the gonads. So they make sperm and produce sex hormones, chiefly testosterone. Testosterone is going to drive the maturation and functioning of the sex organs, but it's also responsible for maintenance and production of those secondary male characteristics. So spermatogenesis takes place in the testes. The testes are outside the pelvic cavity, so outside of the body, in a skin pouch called the scrotum. The word scrotum in Latin, it comes from derivation as a quiver, like a quiver of arrows. It functions in climate control. For sperm to be produced, it needs to be about 3 degrees centigrade cooler, or approximately 93.2 degrees Fahrenheit. There is a muscle called the cremaster muscle, and there's a reflex called the cremaster reflex that is going to elevate the testes for warmth, so closer to the body if it's cold, and then the cremaster muscle will relax, and so the testes can be further away from the body if it's warm. There's also a superficial muscle called the dartus muscle that will also respond if it's cold, will crinkle or contract and kind of wrinkle the skin for warmth, and then if it is warmer, then it will relax. We're going to flip to a slide, and the testes are formed on the posterior body wall in utero, and abruptly, about 7 months gestation, they're going to start their descent to make it from the posterior body wall out the inguinal canal and into the scrotum. Sometimes that doesn't happen, so failure to descend is called cryptorchidism. So we'll look at that in just a minute. We talked about the spermatic cord. It is a protective sheath that's going to be around the nerves, the arteries, the veins, the lymphatic vessels, and also our ductwork, so the ductus deferens, also called the vas deferens, which is that little ring of structures, is called the spermatic cord.
That's what they cut for
Yes, we'll be looking at just a second. So this picture, you can kind of see descent to the testis guided by a structure called the gubernaculum. And it starts roughly 7 months gestation, and it can continue shortly after birth. About 3 to 5% of males born, they're not all the way descended, so one can descend, the other one cannot descend. So it's pretty high, so 3 to 5%. It's not really a problem until if they fail to descend altogether. So by the end of year 1, about 1% have failed to descend. So then they may want to, there's drugs that they can give to sort of help guide this descent, because they need to leave the pelvic cavity for sperm development. If they can't get it to come, or for them to descend into the scrotum, then they'll have to go in surgically and place them in the scrotum. When the testes leave the inguinal canal, inguinal means groin, it's just a sort of weaker opening part of the abdominal wall. If you've ever heard of inguinal hernias, they can often happen there. But kind of look at this picture. So they're being guided by that gubernaculum, but if they leave the body wall, so you've got your abdominal muscles, right? So you've got some fascia, you've got that transversus abdominis, and you have your internal obliques and your external obliques. And so they're kind of going through that opening. They kind of drag some of those structures with them. You also have the peritoneum. So they end up with a lining of the peritoneum, which is going to be the tunica vaginalis. I'll show you in another picture. But that cremaster muscle is coming from the fibers of those abdominal muscles. So they just kind of take some of that muscle with them as they make their descent into the testes. It was just another view, so showing you the spermatic cord. We're going to watch YouTube in just a minute. So you have nerves, arteries, veins, so testicular arteries. You've got autonomic nerve fibers. And because of that cooling, another thing that is done is the venous return, because think the blood leaves the body, it's warm, and it goes out to the scrotum, and then that return that's already been outside, so it's lost some of that heat. So the veins are going to be in a network that sort of helps to cool down the testes, so that piniform venous plexus. And there's that tunica vaginalis from the peritoneum, and then the surface of the testes, we're going to watch this YouTube, you'll notice they're kind of shiny. So they have a fibrous capsule, a coat, so called the tunica albuginea. But yeah, so the scrotum's involved in temperature control. That's for proper sperm formation. If a couple is having trouble conceiving, if the man has a low sperm count, one thing they may recommend is to loosen up on the clothing, wear boxers, do not work with the laptop, because that creates heat in their lap as well. So it's just optimum temperature for sperm development. All right, so sperm are made in the testis, and we're going to look at that when we go to the microanatomy. It's a series of seminiferous tubules, and then the sperm is going to move through the tubules with testicular fluid and go into our next structure, which is called the epididymis. So epi, did, y, miss is how you spell it. It means upon the twin. Don't ask me, I don't really get that at all. But this is the site of sperm maturation and storage. When a man ejaculates, the sperm are going to leave from the epididymis. It's a very tightly coiled tubule. If you were to loosen it and stretch it out, it would be about 20 feet long, but the actual structure itself is about 1.5 inches. It is smooth muscle tube, so it's going to move these sperm along. And there is a head, a body, and a tail, so they'll leave from the tail. There's just a better picture. So here's the testes, and we'll look at it, but then the sperm moves through the seminiferous tubules, and then they're going to go into the epididymis, and then they'll leave an ejaculation out our next structure, which will be the ductus deferens. Vas deferens is another name for this structure. So it goes from the epididymis, it goes through the spermatic cord, up over the pubic ramus, in through the inguinal canal, up over the top of the bladder, and to the back side. When it meets our next structure, which is the seminal vesicle right here, they are going to flow into the testicular fluid with sperm, and then we're going to get some seminal fluid, so part of semen. Our next structure is the ejaculatory duct. So from here, from the epididymis to the ejaculatory duct is the ductus deferens. This is what's clipped during a vasectomy. It's very superficial. They can go in posteriorly and get to the ductus deferens. So there's just a posterior, like we're doing kind of weird mid-sagittal view. So obviously there's two, there's a right and a left testis. We've got our epididymis and then our ductus or vas deferens. These are the ureters over the backside. This is going to be our next structure, the seminal vesicles. And so they're going to fuse, and we have the ejaculatory ducts, which are going to go through the prostate gland. But I just kind of want you to kind of see where we're at and just get a different view. All right, so let's look at the spermatic cord. So there's the testis, this is the epididymis, and then it's going to go through the structure of the spermatic cord.
In addition to the vas deferens, the spermatic cord includes the testicular artery, which brings oxygenated blood to the testes, testicular veins, which bring deoxygenated blood and the hormone testosterone from the testes, and lymphatic vessels and nerves. The veins are arranged to form a pampiniform plexus, which helps to cool the arterial blood, once again to protect the developing sperm from the heat of the core of the body. Since the vas deferens is so superficial, the cutting and tying of the male reproductive tube, known as a vasectomy, is a superficial surgical procedure compared to the equivalent procedure in females, tubal ligation, in which the oviduct, which lies within the pelvic cavity, is cut and attached.
Okay, so just kind of showing you, if we cut the sperm transporting duct, then a man would be incapable of fathering a child. He would still ejaculate, there'd still be semen. Yes, this is an old picture. Don't you love the little knots right there? There have been vasectomy reversals It is a smooth muscle tube that is, when a man ejaculates, is going to go through peristalsis, so those wave-like contractions, quite strongly to propel sperm and semen, out or into the pelvic cavity, and then it's going to be moved out of the body. And so what they realized, so they used to just cut it, tie it in a knot, or just tie these little things, and well, they can come undone, and you've got millions of sperm per ejaculate, and yeah, some of them could make the leap, as it were. I know friends, not super close friends, but her husband had a vasectomy. They had 2 boys, they're in their middle school, and surprise, 8 years after the vasectomy, she found herself pregnant and had to go tell her husband, like, I know you had a vasectomy, but I'm pregnant. So, fun conversations.
Can you imagine? Oh my God.
He took it okay. He did go to the urologist. She's like, he went to the urologist to go, what happened? But yeah, she was didn't think, she didn't think she was pregnant, so she didn't, like, she was like 4 months pregnant by the time she like this is weird.
Mm-hmm.
But if you really think someone's had a vasectomy
together, then you said they make the leap.
Well, if they're just right there.
I mean, it's not too far. Okay.
It's not too far. I mean, I'm not saying they couldn't possibly grow back together.
Okay.
But now what they'll do is they'll go in, they'll cauterize, and they put clips on them.
Yeah.
So no more. They should not be reversing. Okay, so we've got testes. That's where sperm are made. They're stored in the epididymis. So they mature and are stored there. They leave through the ductus deferens. That is that ejaculation. This structure right here, there's 2 of them, a right and left, are the seminal vesicles. They are going to make the majority of semen, and semen is going to be that transport fluid for sperm. It is thick. It is alkaline. Weirdly enough, it has fructose in it. So fructose is the sugar in fruit. Yes, but that is going to be the primary metabolite for the sperm. They also make clotting proteins, and we'll talk about the Spider-Man move in just a minute. That's why I have Spider-Man up there. Other things, so we have prostaglandins that are going to help thin the cervical mucus of the female and cause some contractions in the female that are going to help move the sperm to the uterine tubes. So the ejaculatory duct is about 1 inch long. There's 2 of them. They go through the prostate gland, which is this gland right here. But the ejaculatory duct is where sperm and semen, part of the semen, are going to first meet. And it goes to the prostatic urethra. So like I said, it's just 1 inch long. So from the ductus deferens to the ejaculatory duct, and then the 2 ejaculatory ducts go into this prostatic urethra. So we have our pubic symphysis. This is the urinary bladder. So just below the urinary bladder is the prostate gland. It's about the size of a walnut. It has a urethra going through the middle of it, so it's kind of shaped like a donut. And then you've got the 2 ejaculatory ducts from the right and the left. It is going to contribute the rest of semen, so that transport fluid for sperm. It is more of a thin, a milky fluid. It has fibrinolacins, so to break down clots. We'll talk about that. Health issues with the prostate gland are very common. So benign prostatic hyperplasia, we'll look at it in just a second, but that means it's non-cancerous, and hyperplasia means it enlarges. Prostate cancer is the number 2 cancer in males. Number 1 is lung, and then number 3 is colorectal cancer, but it's quite common. So this is what I mean. So benign prostatic hyperplasia, if this overgrows and enlarges, you can see that it can impact the urethra. And so it makes urination difficult. And like I said, this is something that happens almost to all men as they age. The degree, of course, is going to be variable as far as how much it affects men, but it's just very common, so difficult avoiding urine to actually urinate, or that feeling that they have to urinate often. And so you can see how that would impact the urethra, which is different though than, so it's benign, that word means benign, like it's not cancerous. So prostate cancer is different. It also, once again, we're talking about the prostate gland, but it is unregulated cell growth. It's when you have cells dividing uncontrollably and they get their own blood supply that it's cancerous. So metastatic, so you think about that. Cancerous and has an ability to spread. So 13 in 100 men develop prostate cancer. Like I said, it's not related to benign prostatic hyperplasia. It is 2 times more common in African Americans. But that is the whole reason in a male health exam for the digital rectal exam, they're palpating and feeling the prostate gland to see if it's enlarging. It's like women have breast exams, men have prostate exams. Okay, so the urethra, remember we learned the urethra has 3 parts. So it has the prostatic urethra, the membranous urethra, and the penile urethra. The urethra, we talked about it in the urinary system. We know it is a passageway for urine to flow out of the body, but it's also the passageway for semen and sperm, but not at the same time. When a man ejaculates, that internal urethral sphincter closes. Not at the same time. The average length of the male urethra is 8.8 inches. So contributors of semen were the seminal vesicles, there's 2 of those, and then there's 1 prostate gland. There's another gland called the bulbourethral gland, so there's a right and a left. They are pea-sized. They are kind of very close to the bulb of the penis, which is this part right here, so that part of the root, and the urethra, so that's why they're called the bulbourethral glands. The old name was Cowper's gland. When a man becomes aroused, the bulbourethral glands will secrete a alkaline, sort of slippery, viscous fluid. It'll go through the urethra, and then it will lubricate the tip of the penis, which is also called the glans penis. So the pre-ejaculate, also pre-cum, it's also known as pre-cum. That is not an anatomical term, but typically if I say that, people go, oh, yeah. So. Can you get pregnant from pre-cum? No. The pre-cum has no sperm in it.
Oh, from the...
Yeah,
okay.
but I know, high school, we had this discussion my first class. Yes, if the timing of arousal and ejaculation is quite close.
Right.
You gotta go from here to have a pregnancy, but...
From the actual thing. No.
Yeah, I'm just saying, what's coming out of the bulbourethral gland, it's not semen, it does not have sperm in it. But yes, that's what. But if you're playing with fire, you might get burned.
Yeah.
Sort of, yes. And I think that's why they just tell every girl in high school, yep, that's it, keep it away. Yeah.
Barrier. There's a reason. Barrier.
There you go. Yes. So just, yeah. I won't say it's impossible because I always have students go, well, my cousin, anyway. So highly improbable. All right. So let's just recap semen contributors. We have 2 seminal vesicles. Like I said, those are the ones, they're lateral to the ductus deferens. They're on the back side of the bladder. Thick alkaline fluid contains fructose, which the sperm are going to use to make ATP, so energy. Also contains clotting proteins and prostaglandins. Prostate gland encircles the urethra, so like it's donut shaped, secretes a milky alkaline fluid. We'll talk about why. And then also fibrinolysis. The bulbourethral glands, like I said, old-timey name was Cowper glands. Those are the ones we just talked about, pre-ejaculate upon arousal. Mucus-like fluid will lubricate and just helps the with insertion and neutralizes the pH. All right, so which one is the prostate gland?
E.
B. All right, which one contributes the majority of semen?
A.
Good say. You were right. Don't guess. Yeah. So seminal vesicle,
Wait, is
prostate gland. So these 2 contribute to semen.
Are those flipped on this thing?
No.
Wait, which one's that?
So seminal vesicle, prostate gland. So upon ejaculation, sperm are going to move from epididymis to the ductus deferens, where you get the seminal vesicles are also going to release the majority of semen. That's what I call seminal, and semen, you can see it's in the name, flows through the ejaculatory duct. Prostate gland adds its fluid, prostatic fluid, and then that leaves out the urethra. And then C are the bulbourethral glands close to the urethra and by the bulb of the penis. So this part right here, which we'll look at in a second. All right, so the penis is the copulatory organ. It's for penetration. A lot of it's going to be internal, and it's going to be attached to the ischium. So we're looking at the internal root called the bulb and the crus. I'll show you in just a second. The part that's external is called the body or the shaft. The penis is made up of 3 erectile bodies. I know on this picture you can't exactly see it, so let's go ahead and look at it in cross-section. So there are going to be 2 corpora cavernosa. So corpus means body, corpora is just plural of that. And cavernosa means big and cave-like. And so you can see these big open spaces. So on this picture, all you can see in that view, this right here that's outlined in dark purple is the corpora cavernosa. This is hard erectile tissue. There are going to be arteries that are going to dilate and allow blood flow in. That space is going to fill with blood and a man will have an erection. So it's hard erectile tissue. The other thing, to describe its location, think of the penis when it's erect. This would be the back or the dorsum. This would be the ventral side. So there's 2 corpora cavernosa. So 1, 2, and notice there are deep arteries, and then we also have arteries, so dorsal arteries. So we have blood flowing into those spaces, and when it becomes engorged with blood, it compresses the veins. Some of our veins are thin-walled and compressible. So that's responsible for an erection. And then there's 1 corpus spongiosum that encircles the urethra. This is softer erectile tissue. Think about the urethra. If the erectile tissue is too hard, it would collapse it and close, and we wouldn't get sperm transport. So in this picture, and I realize it's not great, so everything I've outlined in this greenish teal color is the corpus spongiosum. And so it surrounds the urethra. It expands to make the head of the penis. The head of the penis is called the glans penis. That's where there is a high concentration of nerves and sensitivity. So 2 corpora cavernosa, so hard erectile tissue to get erection and sustain it for insertion in the female vagina. And then the corpus spongiosum is softer erectile tissue. So here is a picture. We're looking at the underside, so an inferior view, and we have the pubis, so anterior, and then the ischium would be posterior. And so right here, the corpora cavernosa, they're going to expand on either side attached to the ischium. And so they're called, one is a crus, 2 are crura. So this would be, let's see, the anterior. So right crus, left crus, collectively crura are the legs of the penis. That's what that word means. I come up with it. Once again, I don't get to name this stuff, but that's for the attachment. And then you can see this part right here, this root is the bulb of the penis, and then it's corpus spongiosum that's to be surrounding the urethra, and then it also expands to make the head of the penis. The glans penis is covered by skin. So the foreskin, the anatomical term for foreskin is prepuce, and that's what's removed during circumcision. Not all men are circumcised. In the United States, about 60% of males are circumcised. Globally, it's only about 15%, according to, a search. Circumcision began as part of Jewish religion, so it's a sign of commitment. And then in the early 1900s, the government started saying that this was a preferred method, that it had health advantages, and really that is not necessarily true. There's a slightly reduced risk of HIV transmission, but not really. But it just, now it's sort of, well, Dad is, so just more cultural rather than for health reasons.
Vanity now, so people don't look different. Something.
Well, that's what, yeah, it's just sort of, they put it out there to the world saying, or at least to the United States, saying, hey, this is better, there's be less, risk of infections and diseases, so parents said, oh, well, okay.
For sure.
Right? And then it just becomes sort of a perpetuated thing. Okay, so I think we got everything. I'll give you a few minutes to finish up your picture.